Planned Parenthood and the Center for Reproductive Rights has filed a case challenging 3 long-withstanding anti-abortion laws in Arizona. The 2 agencies held a press briefing this morning to announce the lawsuit. According to the Abortion Fund of Arizona, these TRAP laws, also known as targeted regulations of abortion providers, are meant to protect patients by putting more restrictions on doctors who perform abortions and their facilities. Meanwhile, yesterday, Planned Parenthood and the ACLU of Utah announced they filed a federal lawsuit challenging the state's recent ban on abortion after 18 weeks. Representative Cheryl Action sponsored the Utah bill. She says she recognizes this issue could go to the Supreme Court and could potentially overturn Roe versus Wade.
In the 4 decades since the Supreme Court recognized a woman's right to an abortion, little has changed in the debate between pro-life and pro-choice forces.
But now pro-life groups claim they have a new argument on their side: science. Cronkite News reporter Alyssa Klink is following this debate in Washington.
It was 1973 when the Supreme Court handed down its landmark Roe v. Wade decision. But pro-life groups say there is a critical difference between now and then.
I think science is on our side.
Senator Lindsey Graham, a Republican from South Carolina, is talking about the Pain-Capable Unborn Child Protection Act. It would criminalize abortion past 20 weeks of a pregnancy, the point at which pro-life groups say a fetus can feel pain. While they say science is on their side, pro-life groups say modern science shows just the opposite, and they accuse the bill's backers of pushing an agenda, not science.
That's sort of offensive and disgusting, once again, to see politicians trying to play doctor.
Graham disagreed, noting at a Senate Judiciary Committee hearing that it is common to administer anesthesia at 20 weeks for fetal surgery. Senator Dianne Feinstein, a California Democrat, challenged that with an American College of Obstetrics and Gynecology finding that fetal nerves are not that well developed at that age. The bill does make exceptions for the life of the mother or in cases of rape or incest. It also makes clear that the mother may not be prosecuted, only the provider. Graham is convinced that the tide is turning in his favor.
I think most people, once they know about what we're talking about, that will gain momentum and this will become law.
The majority of the American public supports Roe v. Wade. They want people to have safe and legal access to abortion care.
In Washington, Alyssa Klink, Cronkite News.
Now, this is not the first time lawmakers have pushed the bill. Former Arizona Congressman Trent Franks tried repeatedly to pass a pain-capable abortion act without success.
Even if the Senate passes the bill, it is not expected to go far in the Democrat-controlled House.